Respiratory infections can be a common concern for cat owners. These infections, also known as feline upper respiratory infections, URI, can range from mild symptoms to severe illness. In this video, we will discuss the causes, prevention, and treatment options for common respiratory infections in cats. Causes of respiratory infections in cats. Respiratory infections in cats are often caused by a combination of viruses and bacteria. The most common viruses responsible for these infections include feline herpesvirus, FHV1, and feline calicivirus, FCV. These viruses are highly contagious and can be spread through direct contact with an infected cat. Other contributing factors to respiratory infections in cats include stress, overcrowded living conditions, poor nutrition, and a weak immune system. Cats who live in multi-cat households or are exposed to high-stress environments, such as shelters, are at a higher risk of contracting respiratory infections. Preventing respiratory infections in cats. Prevention is always better than cure when it comes to respiratory infections in cats. Here are a few measures you can take to minimize the risk. 1. Vaccination. Ensure your cat is up to date on all necessary vaccinations, especially the ones that protect against feline herpesvirus and calicivirus. Consult with your veterinarian to determine the appropriate vaccination schedule for your cat. 2. Quarantine. If you have multiple cats at home, isolate any new or sick cats from the healthy ones. This will prevent the spread of infection to healthy cats and give the sick cat an opportunity to recover. 3. Cleanliness. Regularly clean your cat's living environment, including litter boxes, bedding, and toys. Use appropriate disinfectants to kill any lingering germs or bacteria. For nutrition, feed your cat a balanced and nutritious diet to support their immune system. A healthy immune system can better fend off infections. 5. Stress reduction. Minimize stress in your cat's life by providing a calm and comfortable environment. Use pheromone diffusers or calming supplements if necessary. Treating respiratory infections in cats. If your cat does contract a respiratory infection, early identification and prompt treatment can help alleviate symptoms and prevent further complications. Here are some treatment options commonly used. 1. Antibiotics. In cases where bacterial infections are present or suspected, your veterinarian may prescribe antibiotics to target the specific bacteria causing the infection. It's crucial to complete the full course of medication as prescribed. 2. Symptomatic treatment. For viral infections, treatment usually focuses on managing the symptoms. This can include providing supportive care such as fluid therapy, humidification, and nasal decongestants to ease breathing. 3. Nutritional support. Cats with respiratory infections may lose their appetite, making it important to ensure they continue to eat and stay hydrated. In severe cases, your veterinarian may recommend syringe feeding or temporary hospitalization for fluid therapy. For isolation and rest, to prevent the spread of infection to other cats and allow for proper recovery, it is essential to isolate the infected cat and provide them with a quiet and stress-free environment. 5. Follow-up and monitoring. Regular follow-up visits with your veterinarian will allow for ongoing evaluation of your cat's progress. Additional treatments or adjustments to the treatment plan may be necessary depending on their response. In conclusion, respiratory infections in cats can be prevented to some extent through vaccination, cleanliness, and stress reduction. However, if your cat does fall ill, prompt treatment and supportive care can help them recover faster. Remember to consult with your veterinarian for advice specific to your cat's health and needs.